Welcome to our deep dive on multiple myeloma. You guys have sent over some fascinating articles about common myths surrounding this blood cancer, and we're here to sift through those for you on separate fact from fiction and hopefully leave you with a clearer understanding of what multiple myeloma is really about.
Exactly. There's a lot of information out there, and it can be hard to know what's accurate and what's not, especially with a complex condition like this.
Yeah, that's where we come in. So let's dive right in. One of the first myths we often hear is that multiple myeloma only affects older adults. It's something you only need to worry about later in life.
Sure.
But the research you sent paints a slightly different picture, doesn't it?
It does. While it's true that the majority of diagnoses occur in people over 65, younger individuals can absolutely develop multiple myeloma. In fact, there's been a slight increase in diagnoses among those under 50 in recent years.
Oh, wow. That's concerning. So what's the takeaway here for our listener? Should a 30-year-old with persistent back pain be worried about multiple myeloma?
It's always best to consult a doctor for any persistent pain, regardless of age. But the key here is to remember that multiple myeloma shouldn't be ruled out simply because someone is young. Early detection is crucial for any cancer, and multiple myeloma is no exception.
That's a really important point. Okay, let's move on to a myth that can be particularly scary. The belief that a multiple myeloma diagnosis is a death sentence. Thankfully, the research you provided shows this isn't the whole story, right?
Absolutely not. Multiple myeloma is treatable, and advancements in therapies have significantly improved survival rates. For instance, the introduction of proteasome inhibitors, a type of targeted therapy, has been a game changer. Some studies show that these medications have helped increase the 5-year survival rate to over 50%, which is a huge improvement from just a couple of decades ago.
Wow, 50. That's incredible progress. So it's not just about extending life, but about extending it with a good quality of life.
Exactly. And that brings us to our next myth. The idea that bone pain in multiple myeloma automatically means the cancer has spread throughout the body. This is where it gets interesting because it challenges how we typically think about cancer spreading, doesn't it?
It does. I think most people associate cancer pain with the idea of it spreading to different organs. So why does multiple myeloma cause bone pain if it's not necessarily spreading in the traditional sense?
Well, remember that multiple myeloma originates in the bone marrow, which is the spongy tissue inside our bones. The cancer's plasma cells in multiple myeloma actually release substances that break down bone, leading to pain and even fractures.
So it's not about the cancer cells traveling from bone to bone. It's about the damage they cause in the bone marrow itself.
Yeah.
That's a really important distinction to make.
Okay, let's move on to myth number 4, which suggests that all multiple myeloma patients experience the same symptoms. This seems to contradict the idea of personalized medicine, doesn't it? It absolutely does. Multiple myeloma is actually quite varied in how it presents. Some people might have very obvious symptoms like severe bone pain or fatigue. Others might only discover they have it during routine blood work because they have no noticeable symptoms at all.
That's a good reminder for our listener that regular checkups and blood tests are important, even if you're feeling perfectly healthy. Speaking of feeling healthy, the fifth myth we're tackling is the idea that a multiple myeloma diagnosis means life comes to a screeching halt. But that's not necessarily true, is it?
Not at all. Many people with multiple myeloma continue to live full and active lives. There are inspiring stories of patients who continue working, traveling, and pursuing their hobbies, even while undergoing treatment.
That's so encouraging to hear. So what allows these individuals to thrive despite their diagnosis? Is it the advancements in treatment, or is it more about mindset?
It's likely a combination of both. Advancements in treatment have definitely made it possible to manage the disease more effectively and with fewer side effects. But a positive attitude and a strong support system also play a huge role in how someone copes with a multiple myeloma diagnosis.
It sounds like having a proactive approach to both your medical care and your overall well-being is key here.
Absolutely. And that brings us to our 6th myth, the fear that multiple myeloma is contagious. Now, we know that cancer in general isn't contagious, like, say, the flu, but I think this myth might stem from a lack of understanding about what multiple myeloma actually is.
Right. It's easy to see how someone might jump to that conclusion if they don't know the underlying cause of the disease.
Exactly. So let's clarify this for our listener. Multiple myeloma is a cancer of plasma cells, which are a type of white blood cell. These cells are part of the immune system, and their job is to produce antibodies that fight off infections. In multiple myeloma, these plasma cells become cancerous and multiply uncontrollably.
So it's not an infectious disease that can be passed from person to person. It's an internal malfunction of the immune system. Knowing that must be a huge relief for patients and their families. Okay, let's move on to myth number 7, which suggests that diet alone can cure multiple myeloma. I imagine this one can be quite alluring, but it's also a dangerous misconception, isn't it?
It is. While a healthy diet is undoubtedly important for overall health and can even help manage some side effects of treatment, it's crucial to understand that there is no scientific evidence to support the idea that any specific diet can cure multiple myeloma.
So while eating well is always encouraged, it shouldn't be seen as a replacement for conventional medical treatment.
Hmm.
What about the role of diet in managing symptoms or improving treatment effectiveness? Is there any evidence to support that?
There's definitely some research suggesting that certain dietary patterns, like those rich in antioxidants and anti-inflammatory foods, might play a supportive role in managing symptoms and improving overall well-being during treatment. But more research is needed to determine the specific impact of diet on multiple myeloma progression.
So it's an area of ongoing research, but not a cure-all by any means. Now let's talk about clinical trials. Myth number 8 claims that these trials are only for patients with terminal cases, which is a misconception we need to clear up, right?
Absolutely. Clinical trials are research studies that test new treatments and therapies. They are available to individuals at various stages of multiple myeloma, not just those with advanced disease.
So why might someone choose to participate in a clinical trial? Is it purely altruistic, or are there potential benefits for the patient themselves?
There can be benefits for both the individual and the advancement of medical knowledge. For the patient, a clinical trial might provide access to cutting-edge therapies that aren't yet widely available. It also offers close monitoring by a team of specialists.
So it's not just about being a guinea pig, it's about potentially accessing new treatments and contributing to the advancement of research.
I like that.
Okay, myth number 9 deals with the fear of debilitating side effects from treatment. The myth suggests that treatment is always a painful and arduous journey. But surely that's not the whole picture, is it?
No, it's not. Thankfully, medical advancements have led to therapies that are more targeted and often better tolerated. Plus, doctors can work closely with patients to manage side effects through medication, lifestyle adjustments, and supportive care.
So it's about finding the right balance between aggressive treatment and minimizing the impact on the patient's quality of life.
Exactly. And this leads us to our final myth for this part of our deep dive, the belief that there is no hope for a cure for multiple myeloma. It's understandable why this myth persists, but the research you provided offers a glimmer of hope, doesn't it?
It does. While multiple myeloma is currently considered incurable, ongoing research and innovative treatments are constantly pushing the boundaries of what's possible. So where do we go from here? What are some of the most promising areas of research that our listeners should be aware of?
Well, one area that holds immense promise is immunotherapy. This approach harnesses the power of the body's own immune system to fight cancer cells.
That sounds fascinating. Can you give us a little more detail on how that works? I think our listener might be wondering, how can you train the immune system to recognize and attack cancer cells?
That's a great question. There are different types of immunotherapy, but one promising approach is called CAR T-cell therapy. In this therapy, T cells, which are a type of white blood cell that plays a key role in immunity, are extracted from the patient's blood and genetically modified in a lab to recognize specific proteins found on the surface of myeloma cells. These modified T cells are then infused back into the patient where they can seek out and destroy the cancerous cells.
So it's like giving the immune system a boost, a set of instructions on how to target those rogue myeloma cells. That's incredible. It sounds like science fiction come to life. What other exciting areas of research are on the horizon?
Another promising area is the development of more targeted therapies. Researchers are working to identify specific vulnerabilities in myeloma cells that can be exploited with new drugs. For example, there are drugs being developed that block specific signaling pathways that myeloma cells rely on for growth and survival.
So it's about finding those Achilles heels in the cancer cells and developing precision weapons to take them down.
I like that analogy. I'm sensing a theme here. Less collateral damage to healthy cells, more focused attacks on the bad guys.
Exactly. And that leads us to personalized medicine. Researchers are also exploring the potential of personalized vaccines for multiple myeloma. These vaccines would be created using a patient's own tumor cells or genetic information training their immune system to recognize and eliminate their specific cancer cells.
Wow, that's personalized medicine at its finest. It's like creating a custom-designed treatment plan for each individual. So with all these advancements, is it realistic to think that a cure for multiple myeloma might be within reach?
While it's difficult to predict the future, I think it's fair to say that the future of multiple myeloma treatment is filled with hope. The progress being made is remarkable, and there are reasons to be optimistic. That's encouraging to hear.
Okay, before we move on, let's quickly recap what we've learned about multiple myeloma so far. We've debunked 10 common myths and highlighted some of the latest advancements in treatment and research. What are some key takeaways you'd like our listener to remember from this deep dive?
I think the most important takeaway is that multiple myeloma is a complex and evolving disease, but it's not an automatic death sentence.
Hmm.
We now have more treatment options than ever before, and advancements are being made all the time.
Right. And it's crucial for our listener to understand that their experience with multiple myeloma will be unique. There's no one-size-fits-all approach to treatment or coping with the disease.
Exactly. And that's why it's so important to be proactive, to educate yourself about the disease, to communicate openly with your healthcare team, and to advocate for your own needs.
Well said. Okay, I think we've covered a lot of ground today. I'm sure our listeners feeling more informed and empowered. But we're not done yet. We still have 10 more myths to debunk. Are you ready to dive back in?
Absolutely. Bring them on. All right. Myth number 11 claims that only older adults need to be concerned about multiple myeloma. I kind of touched on this earlier when we talked about how younger people can also develop the disease, but this myth seems to persist, doesn't it?
It does. I think it stems from the fact that multiple myeloma is more common in older adults. But that doesn't mean younger people are immune.
Right. It's like saying that only older people need to worry about heart disease or diabetes.
Mhm.
Age might be a risk factor, but it's not the only factor.
Exactly. And with multiple myeloma, we're seeing a slight increase in diagnoses among younger adults. So it's more important than ever to raise awareness about the disease across all age groups.
So what's the takeaway for our listener? What signs or symptoms should they be aware of regardless of their age?
Well, some of the most common symptoms of multiple myeloma include bone pain fatigue, frequent infections, anemia, and kidney problems.
Okay, those are good to keep in mind. Now, myth number 12 suggests that multiple myeloma is a highly contagious disease. This one often stems from a misunderstanding of how cancer works, right?
Mhm. That's right. Cancer in general isn't contagious in the same way that a cold or the flu is. It's not caused by a virus or bacteria that can be transmitted from person to person.
So why does this myth persist, especially when it comes to multiple myeloma? Is it because it affects the immune system?
I think that's part of it. People might hear that multiple myeloma is a cancer of the plasma cells, which are part of the immune system, and assume that it weakens the immune system to the point where it becomes contagious.
Right, like the body is somehow harboring a dangerous pathogen.
Yeah.
But that's not the case, is it?
No, it's not. Multiple myeloma arises from internal factors, primarily genetic mutations within the plasma cells themselves. It's not caused by an external infectious agent.
That's an important distinction to make. Knowing this must alleviate a lot of anxiety for patients and their loved ones. Okay, let's move on to myth number 13, which claims that multiple myeloma is always caused by environmental factors. This one often leads to feelings of guilt or blame, which can be incredibly damaging.
It is damaging, and it's simply not true. While certain environmental exposures might slightly increase the risk of developing multiple myeloma, in some cases, the exact cause is still being researched. It's likely a complex interplay of genetic predisposition, environmental influences, and perhaps even random chance.
So it's not as simple as saying, well, you were exposed to this chemical, so that's why you got cancer.
Exactly. And it's important to remember that even with known risk factors, not everyone who is exposed will develop multiple myeloma.
Right, it's a multifaceted disease, and there's still a lot we don't know about what causes it. Now, myth number 14 delves into treatment options, suggesting that chemotherapy is the only available treatment for multiple myeloma. We've already touched on some of the newer therapies like immunotherapy and targeted therapy, but this myth seems to persist perhaps because chemotherapy has been the mainstay of cancer treatment for so long.
I think that's part of it. Chemotherapy has been around for decades, and it's been an effective treatment for many types of cancer. But the treatment landscape for multiple myeloma has evolved significantly in recent years.
So chemo is no longer the only option on the table.
Not at all. We now have a wider array of options, including stem cell transplantation, immunotherapy, targeted therapy, and even newer approaches like bispecific antibodies, which are designed to engage both T cells and myeloma cells to trigger an immune response.
Wow. Those are some impressive sounding options.
Yeah.
It's amazing to see how far we've come in terms of treatment possibilities. Now, myth number 15 claims that a multiple myeloma diagnosis means a lifetime of pain and suffering. This one can be particularly disheartening because it paints such a bleak picture of life after diagnosis.
I understand why people might believe this, especially given the historical association of cancer with pain and suffering. But it's crucial to emphasize that this is not a universal experience for everyone with multiple myeloma.
So what's changed? Are treatments now better at managing pain?
Treatments have definitely improved, and we now have a better understanding of how to manage pain effectively. We also have better supportive care measures in place to help patients cope with the emotional and physical challenges of the disease.
So it's about a holistic approach to care, addressing not just the physical symptoms, but also the emotional and psychological impact of the disease.
Exactly. And it's about empowering patients to take an active role in their care, to communicate openly with their healthcare team, and to advocate for their needs.
Right. And speaking of treatment options, myth number 16 suggests that all multiple myeloma patients will require a bone marrow transplant. This one can cause a lot of anxiety because bone marrow transplants are complex procedures with potential risks and benefits.
They are, and there's certainly not a one-size-fits-all solution. The decision to undergo a bone marrow transplant is highly individualized and depends on various factors, including the stage of the disease, the patient's overall health, the genetic makeup of their cancer, and their personal preferences.
So it's not a decision to be taken lightly.
Not at all. It's a decision that should be made in consultation with a specialist who can assess the individual situation and recommend the best course of action.
Okay, that makes sense. Now let's tackle myth number 17, which claims that complementary therapies like acupuncture or meditation are useless for multiple myeloma patients. This one seems to pit conventional medicine against alternative approaches, which I think is a false dichotomy.
I agree. While it's true that complementary therapies can't replace conventional medical treatments like chemotherapy or immunotherapy, they can play a valuable role in supporting overall well-being and managing symptoms.
So it's not an either-or situation. It's about integrating different approaches to create a comprehensive care plan.
Exactly. For example, acupuncture has been shown to help alleviate pain, which can be a significant problem for some multiple myeloma patients. And meditation can help reduce stress and improve sleep quality, which can have a positive impact on overall health and well-being.
So it's about taking a holistic approach, recognizing that the mind and body are interconnected, and addressing all aspects of the patient's experience. I like that. Now, myth number 18 suggests that individuals with multiple myeloma should avoid physical activity altogether. This one often stems from a fear of exacerbating symptoms or causing further damage.
It's understandable why people might think that, but it's actually the opposite. Moderate exercise can be very beneficial for multiple myeloma patients.
Really? I would have thought rest was more important.
Rest is certainly important, but staying active can help maintain muscle strength, improve bone density, boost mood, and combat fatigue, which are all crucial for overall well-being.
So it's about finding the right balance between rest and activity, listening to your body's cues, and working with your doctor or a physical therapist to create an exercise plan that's safe and effective for you.
Absolutely. And it's important to start slowly and gradually increase the intensity and duration of exercise as tolerated.
Good advice. Now, myth number 19 claims that there's no point in seeking a second opinion after multiple myeloma diagnosis. This one can be incredibly disempowering, as it suggests that patients have no control over their healthcare decisions.
Seeking a second opinion is almost always a good idea, especially when faced with a complex and potentially life-altering diagnosis like multiple myeloma. A second opinion can provide valuable insights, confirm the initial diagnosis, and offer alternative treatment options that might be a better fit for the patient's individual needs and preferences.
So it's about empowering yourself to make informed decisions about your health and feeling confident in the chosen treatment path.
Exactly. And it's also about having access to the latest information and treatment options. The field of multiple myeloma is constantly evolving, and a second opinion can ensure that you're aware of all the latest developments.
Great point. Okay, we've arrived at the final myth on our list, myth number 20. This one claims that a multiple myeloma diagnosis means the end of your career. This can be a devastating thought for anyone, as it impacts not only a person's health, but also their sense of purpose and financial security.
It's true that a multiple myeloma diagnosis can bring significant life changes, and it might necessitate some adjustments to work life, but it doesn't necessarily mean the end of your career. Many individuals are able to continue working, perhaps with some modifications to their schedule or responsibilities.
So what are some strategies for navigating work life after a multiple myeloma diagnosis?
Open and honest communication with your employer is crucial. It's important to let them know about your diagnosis and discuss any potential needs you might have, such as flexible work arrangements or time off for treatments.
So it's about advocating for yourself and working collaboratively with your employer to find solutions that work for everyone.
Exactly. And there are also resources available to help people with disabilities, including those with cancer, navigate the workplace or organizations like the Job Accommodation Network, JAN, can provide guidance on legal rights and accommodations.
That's a great resource. I'm sure our listener will appreciate knowing about that. So we've come to the end of our myth-busting journey. We've covered 20 common misconceptions about multiple myeloma and highlighted the incredible progress being made in treatment and research. What are some final thoughts you'd like to leave our listener with? What's the most important message you want them to take away from this deep dive?
I think the most important message is this: knowledge is power. The more you understand about multiple myeloma, the better equipped you'll be to navigate this complex journey.
I love that. Knowledge is power. It's a message that applies to so many aspects of life, but it's especially relevant when it comes to our health.
Absolutely. And it's a message that underscores the importance of staying informed, asking questions, seeking support, and advocating for yourself.
Well said. So what are some ways that our listener can continue to learn and stay informed about multiple myeloma? Are there specific resources you recommend?
There are some fantastic resources available. The International Myeloma Foundation, IMF, is a great place to start. They have a wealth of information on their website, including educational materials, support groups, and information about clinical trials.
The IMF got it. I'll make sure to include a link to their website in the show notes for our listener. Any other organizations or resources you'd like to mention?
The Leukemia and Lymphoma Society, LLS, is another excellent resource. They provide support and information for people with all types of blood cancers, including multiple myeloma. And of course, I always encourage people to talk to their doctor or healthcare team. They're your best allies in this journey, and they can answer your questions and provide guidance tailored to your individual needs.
Excellent advice. So it's about connecting with reputable organizations, staying informed, and maintaining open communication with your healthcare team. I think those are great takeaways for our listener. Now, before we wrap up this deep dive, I'd love to leave our listener with something to ponder. You've painted such a hopeful picture of the future of multiple myeloma treatment with all these exciting advancements on the horizon. So my question for you and for our listeners is this: what if? What if we could achieve a world without multiple myeloma? What if this disease became a distant memory, a chapter in medical history? What would that world look like?
That's a powerful question, and it's one that fuels my passion for research and my commitment to patient care. A world without multiple myeloma would be a world where countless lives are saved, where families are spared the heartache of this disease, and where resources can be directed towards preventing other illnesses. It would be a world where the human spirit triumphs over adversity and where the pursuit of knowledge and innovation leads to a healthier and happier future for all.
That's a beautiful vision. And it's a vision that inspires us to keep pushing forward, to keep asking questions, to keep searching for answers, and to never give up hope.
Exactly. Hope is what drives us.
Well said. Well, I think that's a perfect note to end on. Thank you so much for joining us on this deep dive into multiple myeloma. It's been an incredible journey filled with insights, hope, and inspiration.
It's been a pleasure.
And to our listener, we hope you found this deep dive informative and empowering. Remember, knowledge is power, and you are your own best advocate. Stay curious, stay informed, and never hesitate to reach out for support when you need it. Until next time, fellow deep divers. Welcome back to the deep dive. You know, we're continuing our exploration of multiple myeloma. It's been quite a journey so far, don't you think?
Oh, absolutely. Unpacking all these myths surrounding this blood cancer, it's like peeling back the layers of an onion.
I like that analogy. And it's important work because these myths can really prevent people from getting the right information and the right care.
Exactly. They can create fear and confusion, and that's the last thing anyone needs when facing a serious illness.
So true. Well, we've covered 20 myths so far, and I'm feeling much more informed already. But before we wrap things up, I wanted to circle back to something you said earlier about the importance of hope.
Ah, yes, hope. It's such a crucial element in any healing journey, isn't it?
It is. And you seem so genuinely hopeful about the future of multiple myeloma treatment.
Yeah.
What specifically gives you that hope?
Well, I think a big part of it is the incredible pace of research. We're seeing new discoveries and breakthroughs all the time, and that momentum is really inspiring.
Can you give us an example of a recent breakthrough that's particularly exciting?
Well, as we talked about earlier, CAR T-cell therapy is showing remarkable promise. It's a form of immunotherapy that basically reprograms the patient's own immune cells to attack cancer cells.
It sounds like something out of a science fiction movie, like tiny warriors being sent in to fight the bad guys.
In a way, it is, and the results have been very encouraging, especially for patients who haven't responded to other treatments.
That's incredible. So it sounds like immunotherapy is a major area of focus in multiple myeloma research.
It is, and there are other exciting areas too, like the development of targeted therapies that specifically attack the vulnerabilities of myeloma cells.
So we're getting smarter about how we fight this disease. More precise, more effective.
Exactly. And that precision is key to minimizing side effects and improving quality of life for patients.
That's what it's all about.
Yeah.
So it seems like there's a lot to be hopeful about, but I'm sure there are still challenges ahead.
Oh, of course. Multiple myeloma is a complex disease, and there's still much to learn. But I'm confident that with continued research and collaboration, we'll overcome these challenges and ultimately find a cure.
That's a powerful statement. And it brings us back to that message you shared earlier. Knowledge is power.
Yes, knowledge is power, and it's especially important for people living with multiple myeloma.
Can you elaborate on that a bit? What does it mean for our listeners to embrace knowledge in their own journey?
Well, it means being proactive, asking questions, seeking out reliable information, and understanding the different treatment options available.
So it's about taking ownership of your health, being an active participant in your care.
Exactly. And it's about connecting with the right resources, like the International Myeloma Foundation or the Leukemia and Lymphoma Society. These organizations offer a wealth of information and support for patients and families.
Right. They can be invaluable allies on this journey. And speaking of allies, don't forget about your healthcare team.
Oh, absolutely. Your doctor, nurses, and other healthcare providers are there to support you every step of the way. Don't hesitate to ask them questions, share your concerns, and advocate for your needs.
So it's about building a strong partnership with your healthcare team, working together to find the best possible path forward.
Exactly. It's a team effort. And remember, you are the most important member of that team.
Such a great point. Well, I think we've covered a lot of ground today, and I hope our listeners are feeling more informed and empowered. Before we say goodbye, do you have any final words of wisdom to share?
Yes, I do. Never give up hope. The future of multiple myeloma treatment is brighter than ever before, and we're making progress every day.
That's a beautiful message, and I couldn't agree more. Thank you so much for sharing your expertise and insights with us today. It's been a truly enlightening conversation.
The pleasure was all mine, truly.
And to our listeners, thank you for joining us on this deep dive into multiple myeloma. We hope you found it valuable, informative, and inspiring. Remember, you're not alone in this. There's a whole community of support out there, and together we can conquer this disease. Stay strong, stay curious, and stay hopeful. Until next time, deep divers.